Welcome to the WeOn podcast, where we explore fascinating stories and ideas from various fields. In this episode, we uncover reports of the Nipah virus being detected in West Bengal and explain the early symptoms and warning signs people should be aware of. Officials moved swiftly as the situation began to draw serious medical attention. 2 suspected cases of Nipah virus were detected in West Bengal's Bursat, prompting the center to deploy a national joint outbreak response team to assist the state authorities for effective containment. According to officials, the 2 patients, a male nurse and a female nurse working at the same private hospital, were in critical condition and kept on a ventilator. They had gone home in East Midnapore and East Burdwan in December and fell ill. 2 suspected cases of Nipah virus have been reported. They both worked in the same hospital and are now admitted there. We have started contact tracing, said Nandini Chakravarti, Chief Secretary of West Bengal. The samples of both patients have been sent to the National Institute of Virology in Pune for confirmation, a second official said. While the Union Health Ministry has been alerted, the state's Chief Secretary and the State Health Secretary held meetings with the Chief Medical Officers of North 24 Parganas, East Burdwan, and East Midnapore. The Ministry of Health said in a statement on X, Union Health Minister Shri J.P. Nadda assures the West Bengal government of comprehensive technical, logistical, and operational support following the detection of 2 suspected Nipah virus cases at ICMR VRDL, AIMS Kalyani. It added, immediate coordinated action has been initiated. Laboratory support, enhanced surveillance, case management, IPC measures and expert guidance have been mobilized. Shri Nadda spoke with Chief Minister Mamta Banerjee, underscoring close center-state coordination. A national joint outbreak response team has been deployed and standard protocols shared to ensure effective containment. Nipah, or NIV, is a zoonotic virus. That is, it is a virus that can be transmitted from animals to humans. Evidence cited in medical journals shows that fruit bats and pigs host the virus, which can lead to serious illness in both animals and humans. In all the outbreaks of Nipah virus so far, since it was first reported in Malaysia in 1998, patients usually develop a sudden onset of flu-like symptoms. They include fever, headache, respiratory difficulties, convulsions, coughing, and vomiting. Additionally, if the virus is not detected early, then further complications such as respiratory infections and atypical pneumonia may develop. These symptoms can progress quite rapidly, within just 24 to 48 hours, and further lead to coma and eventually death. There is no cure or vaccine to treat the Nipah virus yet. However, it emerged on September 16th that the Indian Council of Medical Research is ramping up its efforts to develop a potential vaccine. Treatments, therefore, are limited to symptomatic and supportive care to treat the signs and symptoms of the illness. If further complications are seen, consideration needs to be taken to treat possible cases of encephalitis, which can be transmitted from one person to another. Therefore, it's important to implement standard infection control practices to limit transfer. Thanks for tuning into this incredible story. If this episode resonated with you, don't forget to hit the like and subscribe button for more captivating stories to come. Stay tuned.